us now is Representative Mark Green, the congressman representing Tennessee's 7th Congressional District. Congressman, thank you very much for joining us tonight. I want to start with the coronavirus outbreak. We've seen the administration's response over the past couple days. We've also seen the legislature kind of providing its oversight. You're on the Homeland Security Committee. How do you feel about the U.S. preparedness for that outbreak?
I think we're in a good place. You know, the travel ban the president put in place right away as soon as we recognized what it was. I thought that's been very protective of the country. If you look at the size of our country, the amount of travel that people do to China, and the fact that we have, very few cases, just over 50 or so, compare that to a country the size of Italy with almost 3 times that many. I think the travel ban's great. As far as the CDC goes, there's been some significant preparations that they've made over the past few weeks. I think we're in a good spot.
And you're also on the Transportation Subcommittee, so I do kind of want to expand on that a little bit and ask you, what conditions would the U.S. have to see for you to want greater travel restrictions?
So obviously we've got to see a significant community-level transmission of the disease. So right now we haven't seen a significant amount of that. There has been some. So we have had, a transmission inside the United States, but I'd want to see more of that before we do a greater travel ban.
And Health and Human Services Secretary Alex Salvi, I believe, said today that the 15th confirmed coronavirus case, it was confirmed in the U.S., so it's not exactly widespread as of yet, but we're seeing right now what's happening in China, and it does get a little bit more concerning, acknowledging the fact that it is kind of spreading there. It's spreading across Southeast Asia, South Korea, Japan, and it's now made its way to Europe. And you're actually a physician as well, so I want to get your opinion on this. Is anything about the coronavirus more alarming than, say, something such as the everyday flu?
Well, clearly its mortality rate is probably less than the flu. So we're actually, the big concern about coronavirus is this incubation period. It's a 14-day incubation period. So you can be transmitting the disease to other people and not even know it. You can be passing the virus on and not even be symptomatic yourself. So that's the part that's sort of going to be a challenge to the CDC and to local health officials. The mortality rate is about, I would anticipate in the United States, probably going to be less than 1%. Over in China, it's about 2%. Their healthcare quality is probably less than ours, I think significantly less than ours. So I would guess, what we're going to see, if we see large numbers of cases, we'll see a significantly lower mortality rate compared to China.
And you bring up the healthcare system in China because that's a very hotly contested debate here in the United States. In fact, last night at the primary debates, we saw once again Medicare for all be a very talked about topic, mostly coming from the progressive candidates. We've also seen even the more moderate ones kind of say that they want to expand the government's role in healthcare. How would that affect something such as a coronavirus outbreak? Would it have any effect on the care and the United States' ability to combat that outbreak?
Well, very clearly, whenever the government controls the healthcare system, if you have Medicare for all, you're going to have quality care for none. So very clearly, overall quality of the healthcare system will go significantly down if the government's running it. That's just the way it is. The thing about coronavirus, most patients will be actually taken care of in their own homes. It'll be the very elderly and those that are immunocompromised that wind up inside the hospital system. And the question is this year is a pretty low flu. It's been a mild winter, so we have a low flu outbreak. I think in terms of capacity right now we'll be okay. But if the government's running the system, they're going to ration care, and it won't be, we will max out the system in a system like that.
And a lot of critics of the administration right now are kind of noting that in the past, the CDC has seen some cut in funding. A lot of that was overseas research. And now we see right now that the administration has offered, I believe it was $2.5 billion in order to help combat the coronavirus. But that was shut down by a lot of the administration's critics, now saying that wasn't enough. Would you like to see more funding in the immediate, or how would you like to see that be addressed?
No, I think the CDC passed its recommendations up to the president, and the president said, okay, $2.5 billion. That's what the Democrats do. Bureaucracy asks for money, and then they give them even more. If you'll recall from the big omnibus a couple of years ago, the president tried to get the defense budget done. In order to get the defense budget done, the Democrats said, well, we want one-for-one match on, other discretionary spending. So the Republicans gave in. They said yes. There was so much money going to some of those bureaucracies, they couldn't even spend it in a year, and they had to go pass an exemption to allow them to roll the money over to the next year. That's how Democrats think. So, yeah, the president comes out with a 2.5 from the CDC requesting it, and they go, oh, well, they probably need more money. I mean, that's just their ideology.
Yeah, it is an interesting move as far as political and optics go. I mean, the American people want to see action taken on this subject. Blocking funding in order to do it is kind of an interesting look. But Representative Mark Green, I really appreciate you coming on tonight. Thank you.
Yeah, thanks for having me on the show.